Okay, Melody, today is January 7th, 2011, and this is the day after your third ketamine infusion, and we call it high dose. Well, why do we call it that? We try to push the dose as high as we can safely over that 3-day period. In your particular case, we got the dose up to 200 milligrams an hour. What limited us in going any higher than that was the fact that you had what I'd call some experience of dysphoria, which we controlled in many ways. Part of it was controlled by giving you a little time out, maybe 5-10 minutes, and part of it was controlled by giving you Versed, okay? Another issue that came up with you that we managed to control for is what we call excessive salivation, was something we see in patients getting the higher doses, and we treated that effectively with the Robinol, or glycopyrrolate. 0.2 milligrams. If we don't treat that, as you know, what happens, you kind of feel like you're gagging on your own saliva. Okay, so we had to deal with these creature comforts in your case, but nevertheless, we got you to an effective dose. And what I mean by that is that you were pretty dysfunctional. We got your brain to reboot because you could not remember what happened 2 seconds ago, yet you could answer some, at least on most occasions, you could answer a simple question like, what state do you live in, right?
Right.
Okay. So the other thing we did just a little while ago is we did your pain thresholds, okay? And there's been what we call a linear improvement, meaning that you didn't plateau after 3 days. You're still going up, which suggests that you're a patient that does have the option, if you decide to go for 4 days, we would expect even greater improvement, okay? All right. So those are just some of the things we learned going through the ketamine 3-day treatment. Also, I will tell you this, you were extremely stable with vital signs, very stable. Breathing, blood pressure, all that was solid as a rock, okay? That's all important stuff to know. Now, what we need to do now is we need to go through those basic exercises again. So let's just start with the vertical finger test, please. All right, any problems with pain there?
No.
You didn't have problems before, and you don't have them now. Okay, go ahead and put that right, keep your head straight, put that right hand behind your head. Any pain now?
No.
You didn't have any before, you don't have none now. Now you did have some issues with the with the left extremity, so hold your head straight, put that behind there. You remember it was on the top of your shoulder, you still have that pain on the top of your shoulder now?
No, that seems to be gone. I have a little bit of pain here.
A little bit of pain there? Okay, so there's some improvement now. In your case, one of the most disabling things was some posterior cervical spine pain, particularly which could be triggered by pulpation. So I want you to go back there and pulp and see if that's been relieved with the ketamine.
Yeah, less sensitive to...
Less sensitive to that. Okay.
Touch, yeah.
All right, good. Next thing we want to do here is once you take that right hand out in front of you, open and close as fast as you can. Good girl. Okay, over here. And again, you're just as good as you were before, so that's good. Okay? Next thing we're going to do is take our attention down to your legs. I want you to take your, lift your pants leg up on the right side a little bit so we can see what's going on. Okay, rotate your ankle for me. Okay, good, good, good. Wiggle your toes for me. Good girl. Hitchhike back to Delaware. Good job. Over here to the left side. Rotate your ankles for me, please. Good, good. Okay. Wiggle toes and hitchhike back to Delaware. Good, excellent. Now I want you to get up and go to the door area over there. Okay. And I want you to just take 3 steps toward me and 3 steps back, please. Okay, very good. Okay, we're going to stop for a minute. We got a lot of background noise going on. Okay, let's do those 3 steps toward me, please. On just normal walk. Okay, 3 steps back, please. Good, good, good. And now I want you to tell me, did you have any pain when you did that? You didn't have any pain before, you don't have pain now. Now, the one thing you did have some problems with, especially on that left leg, was walking on your toes. So take 3 steps on your toes toward me, please. Atta girl. Like a ballerina, huh? Going back on your toes. Okay. Now, remember what your pain was like there, particularly on the back of your knee? You still have that same pain, or is it less, or what?
No, it just feels like a little bit of a stretch, but no
pain. Okay. Next, we want to have you walk on your heels. Okay. Good girl. Walk on back on your heels. That's good. All right. Very good. Did you have any pain when you did that?
No.
Okay. One more thing, and then we're done. Okay. This is sort of a surprise test. Okay. You ready?
All right.
See that black stretcher over there? I want you to leap from there onto the stretcher. Can you do that?
No.
What? Melody? I thought we fixed you. Okay, have a seat. Have a seat. Okay, now, one of the things I thought we would discuss here is, you know, you've been through the low-dose ketamine here in the United States. You've been through ketamine treatments outside the United States. And my question is, particularly on the low dose, I mean, you were let's see, I think you had the low dose for like 14 consecutive days. Was that true?
Like 10 consecutive days.
10 consecutive days, right. How would you compare this high dose that we gave you with that type of intervention? How would you compare it?
I think this is much better functionally. Of course, I've had the coma in between, so I have a different body now.
Right, exactly.
The first one. But with the low dose, I had some relief of just like pain with sitting, or didn't have as much pain when I was sitting or doing no task. But functionally, it didn't really help me that much. Whereas the high dose, functionally, it helps me a lot more. I'm able to do more things.
Right. So again, I think it's important for people to appreciate there's different ways of skinning a cat here when it comes to ketamine, right?
Right.
So I'm going to turn over here to your husband. Your husband was commenting about another difference that you've noticed about the way things took place. Why don't you comment on that?
Well, I think one thing, just to add to what Melody said, when we went through the 14-day...
14.
You're making me laugh. Went through that. That's really time consuming.
Okay, let's. Melody, help me out here. What's going on? What's going on?
With him or me?
No. Okay, so
I promised I didn't sneak any ketamine.
okay, so
Well, actually, the 14. The one thing that was really helpful was the objective. Even when I put this up, the objective measurements are really helpful because you know whether it was worth it or not. You know? And it's a lot of effort to come down and get this problem addressed. And
are we having fun or what? Can you help your husband out? What is he trying to say? Come here and tell us help us out here, Melody.
He's trying to say it's a lot of effort to come down and get these things done. So when we have these objective measurements,
Yeah.
put down on paper, and you can look at them and have a visual image of what's actually
Right.
happening.
Right.
It's much, it's encouraging to
Right.
say what's
Right.
happening and if it really worked.
Right, and of course one of the other measurements besides pain thresholds we made, of course, is the videos, okay, to document
Right.
as precisely as we can. So we really have a very accurate record, and it's, objective in measurement. The other thing we're going to do here momentarily is we're going to take some photographs of your face,
Okay.
and we're going to see if there's been any changes there. Now, okay, going forward here, again, we talked about the heated pool exercise will remain a very important part of your rehabilitation. We talked about the...
Those have helped tremendously.
Oh yeah, right. And you're least likely to re-injure yourself with that type of exercise. That's what makes it particularly so important. And we also talked about stress management, and we discussed that, and how shall I say, in a very spirited manner.
right.
And also, we talked about how you can do your own video recordings as a way to monitor your progress. Now, can you think of anything else that's important for us to discuss at this point?
One thing came to mind a while ago. The difference in, you were mentioning this during the ketamine treatment, like how do you tell the difference between like a musculoskeletal type problem that's going on versus RSD problem? I think that's just important educationally.
Right, and we talked about that. Most patients who experience CRPS symptoms can make that distinction. Throughout your life you learn what a muscle ache is like, and you get trigger points, perhaps that sort of thing, and and we talked about sometimes it's really hard to know if a particular injury is going to lead to CRPS or not.
Right.
We do know, however, that there are certain types of injury that are more potent triggers than others. For example, you sure I didn't give you some ketamine? We talked about oh my God! I'm gonna turn back to you. I can't go over there. I'm completely losing my thought here. All right. Okay. So what were we talking about?
Injuries that lead to CRPS.
Injuries.
Oh yeah. Nerve
Now
injury.
you're the level-headed.
No, yeah, right. Level-headed. Finally, he's coming back. We talked about nerves, nerves, stretching nerves, pulling on nerves, that sort of thing. Particularly the cervical plexus, which is up in your neck, and of course in your shoulder you have your brachial plexus, and of course you have your sciatic nerve going down into your legs. So those are areas that you really want to be really careful not to injure by overstretching them and that sort of thing.
Right.
Any other questions?
I don't think so.
Good. How about you?